Assalamu alaikum dear students. Today we will discuss anatomy most important MCQs part 1C. All are retroperitoneal organs except option A duodenum, option B kidneys, and option C pancreas, and option D spleen. So the correct option is D spleen. Explanation is the spleen is an intraperitoneal organ. Retroperitoneal organs include the kidneys, pancreas, and duodenum. Two yellowish organs that lies on the upper pole of the kidneys are option A pituitary gland, option B suprarenal gland, C parathyroid glands, and option D thymus gland. So the correct option is B suprarenal gland. Explanation is the adrenal suprarenal gland produce hormones like cortisol and adrenaline. If you like this video, please subscribe my YouTube channel. अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे YouTube चैनल को सब्सक्राइब ज़रूर करें. A thick fibrous membrane covers the surface of the bone. It contains blood and lymphatic vessels and nerve called option A endosteum, B medullary cavity, C periosteum, and option D perichondrium. So the correct option is C periosteum. So the periosteum covers bone, providing blood supply and osteogenic cells for repair. So this is very important MCQs. Which muscle title visceral muscles? Option A cardiac, B skeletal, C smooth, and option D all of the above. So the correct option is C smooth. Explanation is smooth muscle lines organs, for example intestines, blood vessels, and involuntary muscle. The cell membrane of a muscle fiber called option A myofibrils, B sarcolemma, C sarcoplasm, and option D sarcomere. So the correct option is B sarcolemma. Explanation is the sarcolemma is the muscle cell membrane that conducts action potential. The area of mucous membrane covering the internal surface of the base of the bladder is called option A apex, B base, option C muscle, and option D mucosal layer, and option E trigone. So the correct option is E trigone. The trigone is a smooth triangular region between ureteral opening and the urethra. So this is the urethral opening and urethra sensitive to the stretch. A mobile cartilaginous and membranous tube that begins in the neck is a continuation of a larynx at the lower border of the cricoid cartilage is option A bronchus, B esophagus, C pharynx, and option D trachea, and option E none of the above. So the correct option is D trachea. The neck of the bladder lies inferiorly and rests on the upper surface. Option A pituitary, B pineal, C prostate, and option D thymus, and option E thyroid. So the correct option is C prostate. Explanation is in male the bladder neck site. So the bladder neck site on the prostate gland. In females, it rests on the pelvic diaphragm. So this is very important MCQs. The thin cartilage plate that becomes ossified at its proximal end during adult life. No ribs or costal cartilage are attached to it, called option A menobrium, B body of the sternum, C xiphoid process, and option D none of the above. So the correct option is C xiphoid process. The xiphoid process is the small cartilaginous inferior sternal part that ossifies in adulthood. The widest part of the uterine tube is called option A ampulla, B fimbriae, C isthmus, and option D infundibulum. So the correct option is A ampulla. So the ampulla is the widest segment with where fertilization typically occurs. The part of the uterus that lies above the entrance of the uterine tube called option A ampulla, B body, C cervix, and option D fundus. So the correct option is D fundus. The fundus is the dome-shaped superior uterus portion above the tube opening. In the lower part of the hip bone, a large opening called option A acetabulum, B pelvic brim, C obturator foramen, and option D pubic ramus. So the correct option is C obturator foramen. So explanation is the obturator foramen is the large opening closed by the obturator membrane transmitting nerve or vessels. If you like this video, please सब्सक्राइब माई यूट्यूब चैनल। अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे यूट्यूब चैनल को सब्सक्राइब ज़रूर करें। A thin serous membrane that lies the wall of the abdominal and pelvic cavities and close the viscera called option A mesentery, B mesoappendix, C omentum, and option D peritoneum. So the correct option is D peritoneum. The peritoneum lies the cavity and covers organ. Mesentery and omentum are peritoneal folds. The largest gland in the body is option A liver, B pituitary, C thymus, and option D thyroid. So the correct option is A liver. The liver is the largest internal gland performing metabolic detoxification and bile production. Thank you for watching my videos.